All right, let's continue with reviewing of the questions. So we'll go on to another child neurology question. A 7-year-old girl, pediatric neurology is hard. So let's see. 7-year-old girl presents to an outpatient neurology clinic accompanied by her mother, who reports that the child has been struggling in school, has not made friends since starting school 2 years ago, and has limited communication even with family members. There has to be some kind of a developmental disorder where the child is not gaining milestones of language, communication, and social skills. When asked about the child's development, mother reports that she did not walk until 2 years old and did not say her first word until 4 years old. So again, very delayed milestone. She has never had psychoeducation testing done, and her teachers are concerned she's not performing at grade level. So definitely, learning disability goes along with the delayed development. On exam, the child avoids eye contact, so no social skills, plays on her own, which is unusual for a 7-year-old girl, but would be normal for a 2 or 3-year-old. Does not interact with a doctor, and cried when her mother asked her to stop playing up a toy and sit on the exam table. So they have kind of a thought perseveration and they wanted to stick with their toy, although any kid would probably cry if you take the toy away. After proper diagnosis, which of the following is most likely to help the child in their development? So step one, it's a two-step question, which is sometimes seen in NBME and USMLE. Step one is you make up a diagnosis and trusting that your diagnosis is right, which is not being asked. Step two is the treatment, which is the best treatment for that diagnosis. So not only you get to the right diagnosis, you should also be aware of the best treatment option. So diagnosis here is a developmental disorder with poor social skill, which is autism spectrum disorder, will be the most obvious one, although the information here is too vague. Um, uh, which probably also forces us to stick with autism because for any other diagnosis that could impair her, we would need more specific information. So many things can cause these kind of presentation, many genetic disorders, but with lack of anything else specifically, and if our workup is normal, we will think of an autism spectrum disorder. For autism spectrum disorder, the question will be, are you going to do CBT, which is likely cognitive behavioral therapy? Now, there's another big no-no. You do not put in abbreviations in answers or in question stems. In NBME, you do not presume that everybody knows the same abbreviation, and not people may have other explanation for CBT. And similarly, there is ABA, and now I'm not sure what they mean by ABA. It could be ankle brachial activity or so on and so forth. But I'm going to assume it's some form of a psychotherapy. And then psychoeducational testing, methylphenidate taken daily, and speech therapy and occupational therapy. So all of them seems to be useful. For cognitive behavioral therapy, it may be a little challenging because you have to have good skills to be able to understand the cognitive aspect, cognitively handle what's going on and have an insight and be able to handle it, which likely is not here. Psychoeducational testing might be the way to go. Often, if your question is being asked in the next step in management, often is more test, more information. So although we're presuming this autism, maybe that is not decided yet by the question writer or by the examining physician. And if that's the case, then the next step may be to do some kind of a neuropsychology, cognitive testing, neurocognitive testing, or psychoeducational testing. Methylphenidate is more for attention deficit hyperactivity disorder, ADHD, where the kids don't sit still and they need methylphenidate to be able to concentrate and focus. Speech therapy and occupational therapy may be helpful for learning disability alone, but here that is not the main issue. Main issue is a neurodevelopmental disorder that needs to be understood more. So it could be something ABA, because I don't know what ABA is, so I don't know if that's the answer. So I'm going to stick with C, psychoeducational testing, and see if I'm right. I'm going to try C, but as I said, pediatric neurology is hard, so I don't know if I'm going to get this one or not. Oh, the answer is ABA, the unknown. Let me quickly look up what ABA is and search it with autism. So I'm getting SBS, which is Strategic Behavioral Solutions for Autism, not ABA. Let me see what ABA is. Center-based ABA therapy, applied behavior analysis, or ABA, center-based ABA therapy for autism. Yeah. So applied behavior analysis is typically apparently the right answer, which likely is the right answer. would testing be done? Should we do a psychological testing first or not, and just go for ABA? Probably just go for ABA if it's obvious enough that you can make a clinical diagnosis, and I think you can. The STEM is priority now, so applied behavior analysis is like, all right. We'll see if there's any other question. Nope. All right, we'll here and follow up next month with some more questions.